This is our presentation on laryngitis. Laryngitis is considered to be one of the most common laryngeal disorders. In fact, all of us have probably experienced it at one time or another. So what is laryngitis? Laryngitis is defined as an inflammation or swelling of the larynx, also known as edema, which can be acute or chronic. When the vocal folds become inflamed, the voice may get raspy, hoarse, or lower in pitch. A person could also partially or completely lose their voice. What does it look like? Pictured at the top are vocal folds which are healthy, and below that vocal folds that are red, inflamed, and thick with mucus, which is what you would typically observe in someone with laryngitis. Let's talk about the etiology of laryngitis, or the cause. The first thing we need to know is that there are two main types of laryngitis, acute and chronic. Acute laryngitis tends to have a rapid onset with symptoms lasting from 1 to 3 weeks. Voice therapy techniques tend to be less effective with acute laryngitis because the common causes of it are not habitual or behavioral in nature. Chronic laryngitis, on the other hand, develops gradually over time and usually lasts much longer than acute laryngitis. The causes of chronic laryngitis are often environmental, behavioral, or habitual, thus lending itself to voice therapy. The main causes of acute laryngitis are exposure to infectious agents, such as viruses, bacteria, and fungi. Viral laryngitis is recognized as the most common type of laryngitis. Bacterial infections are less common. However, infections from surrounding areas of the body, such as the head and neck, can invade the larynx, and these bacterial infections can be treated with antibiotics. Fungal infections may occur with patients with compromised immune systems, such as diabetics and asthmatics. Inhaled steroids can be used to treat such infections. Systemic diseases or their treatment can contribute to vocal edema and laryngitis. For instance, medications for cardiac disease and arthritis affect the cricoarytenoid joints and can damage the larynx. Although acute laryngitis is not caused by vocal misuse, straining to use one's voice while affected with laryngitis can worsen the condition. The main causes of chronic laryngitis are environmental factors such as pollution. Foreign particles in the air can be inhaled and settle in the vocal folds and irritate the tissues in the larynx. Clearing the throat to expel such particles causes extra stress on the voice box and may cause irritation and inflammation. Allergens in the environment can be irritating, while treatment of them with inhaled steroids can also damage the larynx and vocal folds if they are used extensively. Smoking can irritate the larynx and cause inflammation and damage. Acidic and enzymatic reflux can splash onto the larynx and pharynx and cause inflammation. Laryngitis may be the first sign of gastroesophageal reflux disease, or GERD, in some people. Chronic GERD could lead to sores or nodules on the vocal folds and may also increase the risk of developing cancer. Vocal strain, characterized by increased volume and pitch due to occupation, emotions, and physical stress, can cause damage to the larynx and result in vocal edema. This frequent adducting of the folds causes friction between them, and thus swelling and irritation. Okay, so we just talked about the classification of laryngitis into acute and chronic forms. When making a diagnosis, it is also necessary to recognize other conditions that may look like laryngitis or be confused with laryngitis. To review, in acute laryngitis, a patient usually presents with symptoms of upper respiratory infection, dysphonia, or hoarseness. Chronic laryngitis should be suspected when a patient has exhibited symptoms for 3 weeks or more. The cause may be either a recent upper respiratory infection, allergies, or acid reflux. Reflux laryngitis, a type of chronic laryngitis whereby stomach acids back up into the esophagus, is likely if a patient complains of hoarseness that is worse in the morning or has other related symptoms such as heartburn. Rhinitis is an inflammation of the mucous membranes in the nose, caused by a virus such as the common cold or by an allergic reaction, and may coexist with laryngitis. Spasmodic dysphonia is a neurological disorder characterized by involuntary movements or spasms of the muscles of the larynx during speech. This disorder can be difficult to diagnose because the anatomy of the larynx is typically normal. Therefore, voice breaks with an otherwise normal-looking larynx can be a telltale sign of spasmodic dysphonia. Pathophysiology is the study of functional changes in the body that occur in response to disease or injury. With laryngitis, You would primarily observe edema and thickening or stiffening of the vocal folds, which affects their vibratory characteristics. Any change in tissue properties can alter the vibratory characteristics of the vocal fold. When the vocal folds become inflamed, their vibration becomes less regular or aperiodic, causing hoarseness. It may also become difficult for a person to generate adequate phonation pressures, or subglottal pressures, to set the vocal folds in motion, eliciting various degrees of dysphonia or aphonia. Vocal edema causes the membranous covering of the vocal folds to become red and swollen. The irregular thickening or stiffening that occurs along the length of the vocal fold may lead to lowered pitch in laryngitic patients due to increased mass. With respect to imaging, direct fiber optic or indirect laryngoscopy may be used and may reveal redness and small dilated vasculature on inflamed vocal folds, asymmetry and aperiodicity with reduced mucosal wave and incomplete closure of the folds, and the mucosal wave may appear to have two distinct velocities. It may travel at one speed on the surface of the fold, but at a discrete point it changes its speed of travel, due to the edema affecting the inherent motion of the fold in an irregular manner. Perceptual, acoustic, and aerodynamic findings. Perceptual measures refer to listener judgments of vocal quality. Acoustic and aerodynamic measures are physical or acoustic analyses that we can subject a voice recording to, and stroboscopic findings are the parameters observed during direct visual examination of the larynx, such as the movement of the vocal folds. What do we know about the perceptual, acoustic, aerodynamic, and stroboscopic findings for laryngitis? Perceptually, we will primarily note hoarseness and occasionally aphonia. Acoustically and aerodynamically, the findings would include increased jitter and shimmer, decreased harmonics to noise, and decreased fundamental frequency, or lower pitch. The data obtained from the acoustic and aerodynamic measures suggest a thickening of the vocal folds and an increase in the stiffness of vocal fold mass that contributes to incomplete vocal closure during phonation. Stroboscopic measures indicate diminished horizontal excursion and incomplete closure of folds due to stiffened tissue and excess mass, an asymmetry and aperiodicity of vibration, and a reduced mucosal wave due to increased stiffness. Now let's talk about treatment and management of laryngitis. Some laryngeal conditions may result in irreversible damage. However, fortunately, the majority of laryngeal conditions can be treated and managed without surgery. Acute laryngitis typically resolves on its own, since it is often due to a self-limiting viral infection. Simple remedies such as staying hydrated, humidifying the air, and drinking tea with honey can bring immediate relief. Voice rest will allow the vocal folds time to heal. Specialists recommend avoiding antihistamines and corticosteroids due to their potentially deleterious effects on the vocal folds. Extensive use of decongestants can have a rebound effect, whereby when the drug wears off, the swelling returns to a greater degree than before. For chronic laryngitis, one of the most effective treatments is vocal therapy, especially when the chronic laryngitis is caused by vocal misuse. Voice rest also gives the vocal folds a chance to heal. Cessation of exposure to pollutants, allergens, and cigarette smoke will improve the condition of the larynx and reduce inflammation. When it comes to acid reflux, lifestyle changes and dietary changes, such as avoiding spicy foods, not eating right before bed, or keeping your head elevated during sleep, can reduce or prevent acid reflux. In general, an awareness of the impacts of environmental factors and lifestyle choices can help people take the necessary steps to improving the health and wellness of their voice, as well as their bodies as a whole. Coming to our last slide, these are a list of the resources that we use to develop our presentations. Thank you very much for listening.